Supplements. Now, this is the video you all have been waiting for. The dangers of supplements and who should supplement, who should not supplement. Basically, this video will be everything you need to know about supplements, because so many people are incurring some issues for themselves without knowing, because obviously it's as if supplements is running everywhere, the whole world, everywhere. So please listen attentively. My name is Nurse Mary. I'm a nephrology nurse. Basically, dialysis kidney is my specialty. I'm also a naturopathic medicine student. So if you have any question, put them in the comment section. If this is your first time in this channel, do well to like, share, subscribe, and charge the number on the screen if you want to have a one-on-one consultation with me, a doctor, any kind of doctor you want. For those that have hepatitis, fibroids, we have naturopathic doctors that can help you deal with these illnesses. Okay, let's get to it. So now, first of all, what is supplements? Before you take supplements, supplement is basically means, as the name suggests, supplementation. Like, you're giving something that is not enough. So let's say this soap now, right? This is a soap that is given to you, and this soap is not enough, will not be enough for you. What you do is you supplement. You don't throw this soap away, but you supplement. You bring another soap and add to this soap. That is simply supplement. So and a position where this soap right now, you get it and then brings another, you don't get. Now our body is so tricky. That's one thing you need to know. It's not like this soap now. Our body is so tricky in the sense that when you get this soap, the exact soap you're supposed to make up to use, let's say, is like half of this soap. You have to get exactly half of this soap. Okay. Especially for some certain kinds of supplements that our body needs, vitamins. So if you get more than, this is for the fat soluble vitamins now, vitamin A, D, E, and K. I'll come to that. So if you get half full of this soap or more than half of this soap and add to the body, is going to become toxic. Okay, so this is how it is with supplement. This, I just explained to you what supplement is now. So you get, but in a situation where the supplements you have is enough, you don't need to get supplements elsewhere. Now, having known about this now, these are the side effects of supplement. First of all, before you, who should take supplement? The person that should take supplement, who should take supplements now? The person that should take supplements is number one, anyone that is supplement or vitamin deficient. Okay. Number two, it is being prescribed for you. Okay. You don't just go and buy supplements, because there are some health conditions that you may have that you don't know, which will affect you later, or taking that supplement will cause problems for you. These are what people don't know when it comes to do with supplement. But I'm here to tell you how you can even get these supplements naturally. Okay. Now, having known about this, another thing you need to know about supplements is that supplements are synthetic. They are synthetic, means that they are made in the lab. Just as every other medication, supplements also is metabolized by either the kidneys, the liver, and your cells. So your kidneys, your liver have to work on it for you to have it in your body. So taking supplements simply means you're taking medications. They are medications per se, because your organs will, you don't just take it and that's it. Your organs will have to work on it, and doing this often, you are literally stressing your already stressed organ. For those that are even having some issues and they are not even aware, because kidney failure does not show symptoms until it's late. Liver damage, well, may show, but so this is what you need to know, that it is like medications. Okay, you're taking medications, your organs are going to work on it. The next thing that you need to know is that although supplements are good, but they can also affect your organs. Number one, supplements can affect your liver. Supplements can affect your kidneys. Supplements can cause some certain conditions for you, where especially excessive taking of vitamin E can cause bleeding disorders. You start, any little thing, you start bleeding. So there are also some medications. The next point you need to know is that there are some also medications that you don't need to take with some certain supplements. Do you understand? For instance, antihypertensive medications, that's blood pressure medications, you should not take it with zinc. If you're on cholesterol medications, that's statins, for those that have high cholesterol, the doctor gives you some medication. You shouldn't take it with vitamin B3. If you're on some certain seizure medications, example phenytoin and some carbamazepine, you're not supposed to take evening primrose oil together. If you have you're taking some painkillers, NSAIDs like ibuprofen, diclofenac, you're not supposed to take omega-3 or fish oil. If you're on some beef medications as well, like and diuretic like furosemide, you're not supposed to take potassium supplements. So these are some and some other things. So you see, there are some supplements you shouldn't take when you're taking some certain medication. This is why your supplement has to be prescribed by a doctor who knows your history, and you don't just go to buy, because this will cause so many interactions in your body and cause organ damage. If not now, later, or it can stop the medications you're taking, interactions will occur. Then there are some certain hidden ingredients in these supplements that they will not write at the back of those supplements that you're not even aware. For instance, some may have steroids, some may have some certain kinds of preservation, which your body has to work on. Something that is in a place and is not getting spoiled. Something is preserving it. So there's some certain hidden ingredients that may be in some certain supplements that will affect you later in life. Now, long term of supplements will make your organ your immunity kind of low and stable, because they feel they have to relax, because you are supplementing somewhere else. So your body won't have that, won't be eager to fight external forces. So each time you stop taking supplements, you have problem. This is why it has to be prescribed and for a duration. Some people take it all through their life. No. Another thing you need to know about supplements is that is who should now take supplement. You have to do some certain tests. People come to me and say, "No, Mary, should I take?" No, I can't tell you to take anything until I subject you to tests. Until the doctor subjects you to tests. You do some tests. The test will show us which supplement, which vitamin is not in order. And as a naturopath, of course, I'm not coming naturopathic doctor because I'm just studying. I won't prescribe supplements for you. I will give you, except it is extremely low, that you need something to boost it up. I will give you foods, natural things that you will do that will replace this supplement. Because of this side effect that I've said, we are taking medications already that will, our body has to work on. We don't have an option. For instance, those are on diabetic high blood pressure medications, diabetic medications, anti-malaria or something like that. Now your body is working on those medications, which will later have effect. But now you have an option. Why choose an option that will, why not choose the option that you have? Do you understand? So I won't even give you supplements to take. I will which is the purpose of this video now. Tell you what you have to do so that you can get those supplements. Okay? And of course, allergic reactions. Some people may be allergic to supplements. Some are so allergic, they don't even know. In fact, this allergy can be toxic if you are not careful, especially at that first time. If you take it, and again, when you find out that you have allergy the first time, you take it the second time, you will definitely land yourself into trouble. When you notice you have an allergy on anything, don't try it the second time. Toxicity. Some of these supplements, especially the fat-soluble vitamins, like I've said initially, they will cause issues for you when you take them in higher amounts. A, D, E, and K. Vitamin D, which you can get in your sunlight. You take it as supplements and you take excess. There's serious consequences on your health, on your organs overall. So back to the other damages supplements can do for you. Like I've mentioned, kidney damage, liver damage, and for instance now, high doses of protein powders, vitamin D, these protein powders that workers do, that's creatinine, these will have to damage your kidneys, honestly. So when it's just like it's a gradual process, it starts deteriorating your kidney function gradually. But when you take it in higher doses, then the effect will be faster. Okay, so some people may say they've been taking this thing, nothing has been happening. It's a gradual process. Your kidney function, if you had checked your kidney function, let's say months, maybe years later, initially, maybe it would have like 100, now 90, from 90, 89, like that, is coming down, increasing your chances of having kidney failure very fast and sooner. Some other supplements like excessive intake of vitamin A, some of all these supplements, even detox teas, even green teas, excessive intake, even herbal supplements, especially herbal concussion, has seen to deteriorate the liver, cause liver hepatotoxicity. So please, you have to be really, really careful about supplements. Now you've known about the dangers of supplements and everything you need to know about supplements, that for you to take supplements, it has to be prescribed, which means there's a specific vitamins that is not available or is not, you're lacking, then your doctor will prescribe for you, which is not meant to be taken for a very long time. In the cases of women now suffering from PCOS, hormonal imbalance, or trying to conceive or something, or even men, anyways, you notice that your doctor will prescribe and say, take for 1 month, for 2 months. Okay? But people take this thing because they say it's for skin glowing. Meanwhile, you can get this thing in your food. This is treatment, for crying out loud. So it has to be prescribed and for some certain amount of time. And they need to know the doses, the one that is not available with you. But the purpose of this video is not just for the side effect, for you to know how to get these supplements the natural way. Okay? So I have made a video about supplements that you have to take every day. Yes, please locate that video. I don't know if I've posted it here on YouTube, but if I've not, I'll post. I think I'll post it after here. You have to watch that video so that you know the natural ways you can get some other supplements. But let me just mention few for the sake of this video. Finally, taking vitamin C in higher doses will damage your kidneys, will cause kidney stones for you, I beg your pardon. So the maximum amount of vitamin C you're supposed to take in a day is nothing more than 1,000 grams, okay, or 1,000 milligrams in a day. That's a maximum you should take in a day. If not, you increases your chances of having kidney stones. And if you're taking your vitamins, taking water is very, very paramount. Okay, so if you're not taking vitamin C, try as much as you can to avoid these stimulants, alcohol, and all. Not just vitamin C, all the supplements that you think you want to take. Now you now decide if it's better off getting these supplements naturally or getting them through the supplement way. So for calcium, you can get your calcium in dairy products like milk, Greek yogurt, which you can also get in your probiotics. Probiotics are very, very good. You get your probiotics with Greek yogurt too as well. Iru, ogiri, that's for Igbos and Yoruba, and yeah. So get your calcium as well from broccoli, almond nuts, and some certain nuts as well. Your vitamin C, you can get them from oranges, lemon, tomatoes, kiwi, and some certain vegetable fruits as well. For omega-3, you can get them abundantly, more than the supplement form you are getting. Omega-3, you can get it in flax seeds, you can get them in fatty fish, chia seeds. Example of fatty fish is the sardine that not the canned sardine, now fresh fatty fishes. Then for those taking creatinine, you can get your creatinine, which is protein, instead of taking the creatinine, which is a supplement form. Get it in your fruit and vegetables, your meat, your fish, your nuts and seeds. Then for zinc supplements, for those that have skin disorders, you can get your zinc supplements. For men that have prostate or you want to prevent prostate, get your zinc supplement from pumpkin seeds, nuts, cashews, and chickpeas. Then for vitamin D, which is a supplement that you have to get every day, you can get it from the sun. That's the highest point you can get your vitamin D. You can get it now in fish, in oranges, and some other food elements. But sunlight is the primary source. So these are basically ways you can get this natural supplement that everybody is crazy about. And instead of getting them, or you can, if you want to take them, you can take once in a me I have, but if I had known this thing before I had them, I wouldn't have had them. Even when I didn't know, the how to get them naturally. I didn't know that the natural one is even more than supplementing, right? So because I'm a kidney expert, I now do take, probably sometimes 3 times in a week, something like that. But to get your supplements naturally, you have to continue to take these food items. It's not like you take today and then the next time you take 1 week. No, you have to take it. It's a continuous thing before you can be able to get the actual amount that you need for whatever condition that you are having. All right, so I think that is all for now. So make sure that it has to be prescribed. If your doctor prescribes for you, ask them when you need to stop, and always check your kidneys when you are supplementing. All right, so I think on my next video we'll be talking about the oils that are good and the oils that are bad for your health. Like this video, share, let me know if you have more questions and put them in the comment section.